Alright, in this video, we learn about taking a focus history of the patient who's coughing. So sometimes in a ward round, you find a patient is coughing, and the consultants will ask you to take a focused history. Or during examinations on your OSCE station, you find a station which says take a focused history. So in this history, you take history specifically targeting the system where the symptoms coming from. All right, so the format of this focused history is basically introduction, presenting complaint, history of presenting complaint, associated symptoms, exacerbating or alleviating factors, medical history, surgical history, and also family history, social, and then you have to thank the patient, summarize, and then you give a diagnosis. Okay, so on the presenting complaint, they want more information about this cough. The main thing they are looking for is the duration. Is it acute or is it chronic? And then they also want to know if it's productive or non-productive. And also they also want to know if there's anything in the splitter. So there's some patient who are splitter, it has got blood in it. So I was asking this patient, he progressed to ask them, are you producing any splitter when you cough? They're like, oh yes, meaning the cough is productive. If it's not, then it's not productive. Then the color, they want to know the color, because the color shows whether there's blood or not. Then you also progress by asking the amount of sputum they're producing. So that's the thing they want to see in this they are presenting complaint, and of course the duration. Then you move on to the associated symptoms. So these symptoms are those symptoms that are specifically related to the system where this cough is coming from. So as you are clicking other focus history, for example, diarrhea, diarrhea is something they just resist there. So we're going to ask more questions related to that system. So in our case with cough, you can ask why there's fever, there's shortness of breath, there's wheezy, there's night sweats. I'll put a list of the symptoms that you may want to ask in this case. Then you progress to exacerbating or relieving factors. So we just want to know more about what's making this cough better or worse. Let's just ask the patient what's making this cough worse. Some theory, when I lie down flat, the cough is getting worse. When I sit upright, I'm feeling much better. Or when I open the windows, I'm feeling much better. So yeah, that's more information about this cough. And then on the medical history, I want to know more about this cough as usual, because remember this people are focusing on the cough, specifically on the cough. So I want to ask if they are presenting in this where I say long-term lungs can be prepared with cysts and mucoria. In as other conditions, in other system that may cause cough. So you may ask such things. And you also going to ask about other chronic conditions like diabetes, tuberculosis, hypertension, sickle cell. Remember the dates, and of course HIV status. Then you progress to surgical history. That's about if they had any operations. Then you progress on in history. On history again, you're going to ask if is anyone in the family presenting with the same problem. Then of course ask about a day. Remember, like money. That's whether anyone is presenting with what diabetes to be asthma and all that in family history. And then we progress today, sexual history, as it has gathered outside the usual area where they stay, as it have been contacted on a TB, a small dream, and the occupation. Remember, when asking about smoking, you need to ask how long and how many parts of it's less per day. And that's the same thing of how long and how many days you take a day. Occupation, remember, there's some job that made. For example, blacksmith, people work with metal or people in coal mines, they tend to have very respiratory infection to the coal. Yeah, and they ask a patient, but they have 10 questions, then you answer the questions, etc. You thank the patient and summarize everything.